In 2021, my wife became very seriously ill very suddenly within a matter of 3 or 4 days, and she was diagnosed with category 4 brain cancer, glioblastoma, inoperable. From that point in time, it was a fight as to which hospital we were going to be in. Could we coordinate benefits between hospitals? What kind of treatment she could get as she got progressively worse? It was absolutely horrible.
When Medicare Advantage plans were first really taking off, we were listed as a network provider, and we weren't. The first person that showed up with this card, I looked it up and said, they show us as not in network. And they were furious because it was sold that we were in network. And they had done exactly that. It was bad enough, and they sold it to enough people locally that I reported it to CMS for contracting issues.
The worst part is dental. Trying to find a dentist was virtually impossible. Even the dentists that they listed as in their network, they just were not accepting new patients, at least when I told them that I was a Medicare Advantage patient.
I just recently had a patient who had a lot of chronic diseases, came in and needed a major abdominal surgery. Basically, our physical medicine and rehabilitation specialist evaluated her and said, this person needs acute rehab, but she is Medicare Advantage. And so insurance off steps in and says, no, she's healthy enough to not go to acute rehab. This is someone who miraculously survived this hospitalization. The only thing that's going to keep her out of the hospital is going to an acute rehab. And you're telling me, having never met this patient, that we're incorrect in that assessment. It's offensive. It's very difficult to have your judgment questioned by somebody who's never met the patient and whose interest is not in the care of that patient. It's in the distribution of these resources that this insurance company deems appropriate.
I learned more about this disadvantage of Medicare Advantage. We get worried. Access to a specialist, for example, may get restricted. My worry is now being upcoded. How much is going to be the Medigap cost? And then does the gap close? And seniors now get discriminated against based on their upcoded profiles.
They sit in the hospital, and then we try to come up with a different plan. So then it increases our length of stay, and then the patient can develop something else while they're here, like a hospital-acquired pneumonia. He was recced for acute rehab. He has MAP Humana HMO. He was medically ready last week, so the insurance denied him, and then we had to do an appeal, and we're waiting on the results, and he's been here for 20 days total. But of those 10, we've kind of been going back and forth with insurance. And then he developed pneumonia.
The Medicare Advantage plan at that time was trying to switch the patient from one calcium channel blocker to another, and also encourage them to get their drugs by mail order. In the wake of all of this shuffling around, the patient became confused about their medications, and the patient came in profoundly hypotensive. It was a pulling apart of the part of medicine that's most important, the doctor-patient relationship and the pharmacist-patient relationship. It was all about the dollar.